going to ask you to cue. Perfect. Thank you so much. And if you could advance to the next slide, please. All right, awesome. So welcome to part 2 of Harnessing Data for Impact webinar series. So I'm just going to ask, as you are joining, to please just introduce yourselves in the chat. If you could share your name, your title, your jurisdiction, city and or state, as well as the agency or organization that you're representing today. And I am going to start by introducing myself, and I'll also have my other NASDAQ colleagues on the line do the same. My name is Kaniqua Outlaw, and I am the Data Integration Manager on NASDAQ's Health Systems Integration team. And I'm just going to kick it to Brittany and then Zoe to do the same.
Hi, everyone. Thanks so much for joining us for part 2 today. My name is Brittany, and I am the Senior Manager of Monitoring, Evaluation, and Learning at NASDAQ.
Hi, good afternoon, everyone. My name is Zoe Sasser. I'm an associate on the Health Systems Integration team, and I'm excited to be here with you guys today.
Awesome. Thank you both. And so I will say that if you have attended any of the meetings that NASDAQ has hosted or co-hosted, you know that we usually try and feed you for the afternoon slump. But unfortunately, we can't do that because this is a virtual gathering. But I have virtually extended some nice looking macaroons that I hope that will tide you over as we kind of share some good details today about using data as part of your monitoring and evaluation approaches. So next slide, please. All right, and I'm gonna share this slide with Brittany to just give a recap and set the stage for today's session.
Thanks, Kaniqua. So if you attended our last webinar in the part 1 of this series, we talked about systems and EHG as a system and why that requires an innovative approach to thinking about evaluation in EHG. We also introduced a multi-level evaluation approach and NASDAQ's EHG evaluation planning worksheet, which will review the second part of that worksheet in today's presentation regarding identifying data sources. So if you didn't have an opportunity to attend, I highly recommend watching the recording after today's webinar, which should have been sent to everybody who registered for this webinar series. But if you did not have the opportunity to attend and did not receive that recording, please feel free to reach out to any of the NASDAQ colleagues, but me, Kaniqua, or Zoe, if you need that.
Thank you so much, Brittany. So we have 3 overarching objectives for today's webinar. The first is to walk through exploring some methods for linking evaluation questions with appropriate data collection methods. Then we'll also talk about learning about different data sources to maybe help you answer those evaluation questions more effectively. And then finally, we'll examine some methods for analyzing and interpreting those evaluation findings. So throughout your evaluation, you'll really want to consider why you're conducting the evaluation in the first place. So for instance, what evaluation questions are you seeking to answer? And you'll probably hear me mention evaluation questions more times than you probably want to hear throughout this conversation. But I really just want to hone in on why it's important to have a sense of what questions you want to answer, because that will help you guide your evaluation approach. We'll also talk about whether it's feasible to conduct evaluations with particular approaches, considering the staff, time, effort, and resources that are available to you, and also consider whether or not you have access to the data that you need to answer those evaluation questions, as well as how reliable or accurate the data that you have available to you is in helping you make conclusions and recommendations. Next slide, please. All right. So this slide, I tried to represent or outline a proposed cycle for using data to evaluate your program processes and outcomes. And so I'll also follow this flow as a guide to the presentation today. And I'll be focusing really on those first 5 steps. I won't get to every step in this visual, but primarily we'll focus on the first 5 steps. So the first of which is identifying process measures and outcomes. So these are going to be related to SMART objectives, which I'm pretty sure most of you are already familiar with. Then we're going to look at identifying evaluation questions. And then after that, we'll talk about identifying appropriate data sources to answer those evaluation questions. After that, we'll talk a little bit about what it means to gather available data or evidence. So this is once you've identified what data can answer those questions, how do you go about obtaining it? And then finally, today, we'll broach a little bit on analyzing the data. So once you've collected the data, how do you go about using it and making those decisions? Now, the last three steps are to summarize and interpret findings, communicate results and make recommendations, and then to act on those findings. And we could honestly spend an entire session on each component alone. And for that reason, we won't get a chance to cover the last three today, but I just want to emphasize that this is a process. It's not necessarily a linear process. You will find that you'll revisit each of these components at various stages, but I really want to hone in here that this is an iterative process, and it is key, and we actually encourage you revisiting different components as you work through your evaluation plans. Next slide, please. Thank you. All right, so now we're going to talk briefly about identifying your process measures and outcomes to help you define those evaluation questions. So most of you probably are already very well versed and familiar with using SMART objectives. And I want to emphasize here the importance of using SMART objectives because they're what's going to help you inform developing your process measures and outcomes. So using SMART objectives from your EHE work plans is going to help you not only identify what those measures and outcomes are, but asking questions during the planning phase can actually help you build a process for measuring progress at the very beginning, which makes it easier because if you already have a plan for how you're going to, collect data that you're going to use to answer those questions, then that's one less thing that you have to worry about figuring out after your programs are already underway or being implemented. So here I want you to think about how your SMART goals or objectives are related to your process and outcome measures or measure outcomes. So you're looking from making sure that your objectives are specific. So of course, how do those objectives relate to the outcome that you want to measure? So you're thinking about who's going to be impacted, or who's your priority population. So for example, a specific objective might be reducing the percentage of Black women who've been prescribed PrEP in the past 30 days. You're also making sure that you can identify the data used to track progress. So this is where it's important to make sure that those objectives are measurable. And you're going to use those measures to show progress towards a target. So your measures should be tied to a specific data source. So for instance, this is asking how much and in what direction a change occurred. Another example could be using surveillance data, for instance, to show a 10% decrease in the number of Black women diagnosed with HIV in the past 3 months. It's also key here to make sure that you set realistic targets that can be measured with the data available to you. I want to emphasize with the data that is available to you. It's really important to think realistically about what your team, your organization, your agency can achieve with the available resources, knowledge, and time. If it's going to be something that's going to really require a big endeavor or, taking on, software or approaches that your team may not already be familiar with, you want to weigh whether or not that's feasible for this objective or if that's something that can maybe be, scaled out a little bit. So here you'll think about how you're going to accomplish an objective, what resources do you have to support that objective, and also consider, are there any barriers or constraints that might impact your ability to achieve an objective or evaluate a certain component or measure. So that's really something that we want to make sure that we're making sure that we're being ambitious, but not too ambitious with the time and resources that we have available to us. You'll also want to make sure that you align those objectives with, for instance, outcomes of interest or those that are important to your program goals. So you'll want to consider whether or not, if you're looking at an objective being realistic or relevant in some frameworks, does that objective align with your organization's goals, mission, vision, and values? Also, is it important to your stakeholders or your priority populations? And here we also emphasize making sure that you're involving people with lived experience and those stakeholders throughout this process, because they're going to really provide that additional context to help you determine whether or not you're focusing on realistic or relevant objectives. And then finally, you're looking at whether or not that objective can be reached within a given time frame. So you want to make sure that as you're developing those SMART objectives, or those SMART goals and tying them in with those process or outcome measures, that they're attached to a reasonable date. And also consider not just, if it's attached to a reasonable date for accomplishment, but also consider whether or not you're going to have the data available within that time frame that's going to help you actually access or measure that progress. So for example, if your objective is to use surveillance data to measure changes in the new number of diagnoses in a certain time frame, are the data going to be clean, processed, ready to make the observation, or are you going to have to rely on preliminary data, for instance? So those are just some things that you'll want to consider. Now, you'll also notice here that I've also included two additional components of the SMART framework. The inclusion of inclusivity and equity transforms this into the SMARTY framework. So here, when we talk about inclusivity, this is making sure that you're addressing potential biases or disparities. And here you want to consider populations that have been historically excluded or are disproportionately impacted. So how does your program aim to address those disparities? And then considering whether or not your program objectives are promoting equity and fairness. Are you including input from people with lived experience, for example? And I mentioned these components, not just the SMART goals, but also making sure that they are inclusive and equitable, because it's important to get that input from people with lived experience, from people who've been disproportionately impacted along the way, because this is why we're doing that work, and really having them inform this process and be a part of that process as much as possible is what's going to make your findings and your approaches that much more robust. Next slide, please. Thank you. All right, so process, measure, and outcomes to guide your data strategy. What does that mean? So the point that I want you to take away from this portion is that the data collection strategy that you choose should be informed by the evaluation questions that you want to answer. So looking at process and outcome measures, for example, if you attended part 1, then Brittany did a really good job outlining the distinct differences between different types of measures. So I'll focus on just the two for this example. So process measures, this is asking the what. What is it that you're doing? What is it that you're implementing? Your process measures should tie directly to your SMARTY or your SMART goals. Here you want to ensure that your process measures are in alignment with those components. And the focus should be on activities and resources. So you should consider what data can help you assess whether or not your program activities or your resources were implemented as designed or as intended. Now, your outcome measures, here's when you're asking, okay, this is the process that was implemented. This is what I did. Now you're asking yourself, so what? So what kind of change was perceived or observed? What direction did those changes occur? So these outcome measures should be connected to your SMART or SMARTY goals so that you can ensure that you're directly addressing the outcomes that you initially outlined during your goal or objective setting. It's also important here to identify what data is going to help you measure your initiative or your program's impact on your priority population. So defining your processes and outcomes with the help of your SMARTY goals helps you determine that your evaluation efforts are focused on the right populations, use the right resources, that they're relevant to the priority population and the program objectives, and that you have enough information to guide making those program improvements. Because if you're going to spend money, if you're going to invest time, you want to be able to justify that. And this is what's going to help you do that. The emphasis here is on making sure that your process and outcome measures can be clearly informed by your data, which will also help you to answer those evaluation questions. And taking care in choosing your evaluation questions is what's going to help you define the work that you're doing. And that will also allow you to follow a specific process to follow in order to get the job done. Now, the most important reason I think for clearly defining your process and measure outcomes is because it guides the data collection process. So defining those outcomes, carefully constructing your evaluation questions is what's going to inform where you get the data from, how you're going to use that data, and even how you're going to interpret your findings. Now, the benefits are very clear when you're starting to ask these questions before your program is implemented, since these questions will help you identify early on what data needs to be gathered to answer those evaluation questions. Now, that's easy when you're thinking about beginning to plan or implement a program before it's on the ground. But I understand and recognize that for many of you, your programs may already be underway. So it may not seem as feasible to start asking these questions. But I just want to say, don't despair, because there's never the wrong time or it's never too late to ask those evaluation questions, or ask those questions about what you want to be able to answer from your populations or your programs, because that also gives you the opportunity to make improvements or adjustments if need to. And this provides the evidence that you need to justify making those adjustments. I also want you to consider how your evaluation questions and data strategy can inform and influence the larger system. So thinking about, the HIV ecosystem, all of us are navigating that. Everything that we do, the populations we interact with, they have kind of a boomerang effect, because it goes back and impacts the larger system. So think about how your findings can inform policy and program decision making. Is the question that you're asking important enough to justify funding, staffing, or resource allocation? Will the answers that you get from the evaluation question lead to some kind of programmatic or response action? Also ask yourself, do I have access to the data that I need to answer my evaluation questions? And there might be multiple events or causes that might drive the value of your evaluation questions and subsequently those program objectives. And also think about really, how does understanding those events, those sequences of events bring value to your program? How can you respond? How can you make those improvements? So those are just some ways to kind of think about, not necessarily separately, but how all of these things kind of interact to really guide that data strategy, but specifically starting with making sure you know and have a good understanding of what your potential process and measure outcomes are going to be. Next slide, please. All right. So now that we've kind of walked through, identifying process measures and outcomes, talking about the importance of using that to kind of drive identifying your evaluation questions in concert with, those SMART goals or objectives, we can now talk a little bit about identifying those data sources. Next slide, please. Thank you. So the data sources that you choose for your evaluation are going to be determined by several factors. So some questions that you might ask as you're starting to think about what data sources to use are, what information is going to help guide those evaluation questions? What's going to help you determine whether or not you're serving your priority population? How are you going to assess whether or not your program had the intended impact? And what information is going to help you gauge whether or not a change in behavior outcome could be directly related or explained by your program or your initiative? Now, this infographic comes from the CDC, and it captures how different types and levels of data might be considered throughout the evaluation process. So you'll want to use a combination of data sources to capture the most comprehensive view of your EHE programming. So for instance, there are different types of data collection or data that you can use. So that's either quantitative or qualitative data. You may have different levels, which for most of you, local level data is probably going to be the most useful or relevant, but there are also some considerations for using state or national level data if you want to make broader comparisons to see how you may be doing against similarly structured counterparts. You'll also consider whether or not, I think this time is what I'm going to emphasize is balancing the need to use existing data sources, which many of you probably have already been using, for instance, data from Brian White, surveillance, or other programmatic data. But we'll also talk about some approaches later that you might want to use to create new data collection tools that's going to help you really inform and find out about the unique needs and strategies employed by your EHE programs to really reach those populations in an innovative and more tailored way. Next slide, please. All right, so ideally, you're going to use a mix of data collection methods and sources to make your evaluation findings more comprehensive. And I'm sure many of you are familiar with the distinct differences between qualitative and quantitative data collection, and you're likely already implementing both of those types into your existing work. But just for level setting sake, I will briefly touch on, kind of the different data collection tools and methods that you can use depending on the data collection approach that you're considering. So of course, I have some examples here about, quantitative data is used to quantify, what's happening, versus qualitative data is really going to provide that context behind why something happened or why something occurred. So I just want to say that quantitative data is really going to be useful if you're looking at assessing patterns or trends or interesting relationships that might develop over time. You'll also use that to assess program effects. For instance, has there been a reduction in disparities, barriers, or an improvement in quality of life? From a process or operational perspective, quantitative data can also help you calculate the resources you need to support implementation. And this is going to inform, for instance, how many staff are needed salaries, supplies, transportation. So if you're thinking about getting a particular program or initiative off the ground, what is it going to take for you to be able to do that? And this quantitative data can help you inform that. And this is also integral, like I mentioned before, if you want to compare your program outcomes to state or national benchmarks. So how well do I do against my counterparts? For a similar population, for a similar initiative, how do we compare? Where do we see gaps, or where do we find opportunities to really narrow what those gaps might be? On the other hand, your qualitative data is going to really assess perhaps what to include during program planning. So this is where, if you're conducting focus groups or interviews or observations, what context are you going to learn from people to really help you inform how programs should be carried out or designed? You'll also be able to get feedback during initial implementation. So this means getting context behind why a program or initiative is more successful than a counterpart, for instance. And that qualitative data is also going to be useful in helping you understand why implementation isn't working. So are there maybe facilitators or barriers to implementation that you can really get and learn from your priority populations? And if so, utilizing that to inform that decision making. Next slide, please. So again, I'll reiterate here that you'll want to use a variety of methods and data sources to answer your evaluation questions. So this is going to give you a holistic view of your EHE programs and initiatives. And this mixed approach can also sometimes be referred to as triangulation. And as you've noticed, maybe in the previous slides, I've used this cycle to demonstrate the flow of topics for today's agenda, as well as a process for using data for EHE evaluation. However, this infographic serves another purpose because it demonstrates a process of triangulating data to assess impact. So according to researchers, public health triangulation is defined as the process of reviewing and interpreting secondary data from multiple data sets that bear on the same question to make public health decisions, combining elements of both data triangulation and method triangulation. That's a mouthful and not always super easy to remember, but I will say, more simply stated, triangulation in public health is a process of capturing and analyzing data from multiple sources to understand the impact of public health programs. So this is going to give you a more complete story of how your programs are making an impact. Now, this graphic was adapted from the public health triangulation process that was outlined by some researchers who examined how to use and interpret data from multiple sources so they could understand national and local HIV epidemics. So I would say this is rooted in practice and rooted in evidence. So this comes from researchers who are doing this at various scopes and within various scopes and scales. And I will say at the heart of this, and I mentioned this before, is that you want to include stakeholders and people with lived experience during each stage of the process. They're going to bring valuable and unique perspectives and help you determine priorities that are going to be vital to understanding the impact of your EHE programs. So ultimately, what I want you to take from this slide is that you want to use some kind of triangulation of your data to help give you a holistic understanding of the impact of your programs. Next slide, please. Awesome, thank you. So I want to give you maybe a real world example to provide some context behind public health triangulation and what that means. So in this example, we're going to walk through, or I'm going to walk through an evaluation question that asks, how effective is a mobile health unit in improving access to HIV treatment services among Black women that live within a certain zip code or geographic area? Now, you could use a combination of data sources to help you evaluate the effectiveness of the mobile health unit on this population. So for example, your program might consider conducting focus groups with clients so that you can understand their barriers to accessing treatment services, the types of treatment services that they're likely to use, or for instance, what other services or resources might be valuable to include with the mobile unit. So one example of that would be from a focus group or interview, you find that they would find pharmacy service, hygiene supplies, condoms, snacks or drinks. If people are going to the mobile unit or the doctor, depending on, where they are and how long they have to wait, people get hungry, people get thirsty. So also considering what else might be important to people if they're going to show up to these services. And this is what helps you determine what factors are going to make that intervention of, in this example, the mobile unit more likely to be utilized. You'd also be able to evaluate whether or not your priority population is being reached. So through qualitative data, for instance, observation, just a simple observation of who's showing up. That's another key way to get that information. You could also consider interviewing staff, since they are the ones that are providing the services. They're the ones driving there. They're the ones providing those services throughout the mobile unit. Is the unit reaching the intended areas? Is it underutilized in some areas and perhaps overwhelmed in others? Think about how that would be really useful information to guide your program evaluation strategies. You might also consider using administrative data, for instance, so that you can quantify the number of people who access services as well as their demographic characteristics. This is also going to be another way for you to inform whether or not your priority population is being reached. The goal here is to really talk about using a variety of approaches and data sources to help answer that evaluation question and assess impact. So by combining, the qualitative data, i.e. interviews or observations, the quantitative data, for instance, it could be specific data from like provide enterprise careware, electronic health records, however you're using to maintain or deliver that service, that's going to help you assess whether or not the priority population is being reached and identify factors that might impact the effectiveness of that resource. So is it the geographic location that is consistent, where we see people are attending consistently or not? Is it the service hours? Should we offer weekend hours? Is it stakeholder partnerships? Are there other partners who we might be able to collaborate with to make the service more effective and reach more people? So those are just some ways that you can use those different data sources together to really learn how those individuals are being reached by asking that evaluation question. And so I will, next slide, please. And I think here, I will turn it over to Brittany to talk a little bit about that initial evaluation framework that she touched on in the first session and how we're going to utilize that later on today.
Thanks, Kaniqua. Yes, so in a few minutes, we're going to thoroughly walk through exactly how you can identify data sources and how you can use that to answer your evaluation questions. But before we walk through that example with you all today, we want to quickly review this multi-level evaluation framework, which we introduced in our last webinar, and then how thinking about your work in this way can help you identify the right data sources to answer your evaluation questions. So if you attended our last webinar, you have seen this before, and this might be a little repetitive, but we want to review it just because it's so important to identifying data sources in your evaluation planning. So on the right side, where I think most folks are familiar with, are the 4 EHE pillars. The 4 EHE pillars are what informs your strategies and interventions on the left, but it is also what you're aiming to accomplish with your strategies and interventions, or in other words, your long-term outcome measures. On the left-hand side, we've broken down the strategies and interventions into levels of evaluation, or where we see opportunities to measure impact. All EHE goals are tied to client level outcomes, but the strategies that are being implemented to achieve those goals also have effects on other aspects of EHE that could lend itself to evaluation, which is why we've broken it down into these 4 levels of jurisdiction, jurisdiction staff, subrecipient, and client or priority population. Depending on the strategy, you may or may not be evaluating at every level, but you should be thinking through the process, short-term outcome measures, intermediate outcome measures, and then obviously the long-term outcome measures for all of your strategies and interventions. Next slide, please. So in part 1 of this series, using that framework as a guide, we used an example to walk through the first 3 steps of the evaluation planning process, which are defining your evaluation levels, determining your process measures and outcomes, and developing evaluation questions. So for today, we're taking the same example, and to simplify the exercise even further, we're only going to use one of the strategies. So we can walk through together on how one might go about finding data sources to monitor and evaluate their EHE strategies and activities. So in this example, you're an EHE coordinator at a state health department, and part of your EHE work plan under the TREAT pillar is a goal to increase linkage to high quality and culturally competent care among the priority population of young Black MSM. One strategy you'll be using to reach this goal is creating a mobile app for newly diagnosed and people living with HIV to stay in contact with an HIV care linkage specialist. So for the next couple slides, I'm going to quickly review what we did for steps 1 through 3 in our last webinar, and then I'll hand it off to Kaniqua to walk us through an activity to help us identify some data sources for this example. So Like I said, I'll be going through the next couple slides quickly. So feel free to take screenshots or take pictures of the next few slides to help you with the activity that we'll do in a few moments. So for step one, we've defined our evaluation levels, or in other words, we've categorized our work into the areas where we see that there's an opportunity to measure impact. So in the right-hand column, we've indicated if we would plan on assessing at that level, and if so, who or what does that entail? In our example of the linkage to care mobile app, we've indicated that we plan on assessing at all levels, and we didn't identify any other levels outside of the framework. Next slide, please. So next, we developed some potential process measures and expected short-term, intermediate, and long-term outcome measures. This isn't an exhaustive list, but it was just something to get us started. Just so you have a general idea of sort of what are those process and outcome measures that we're expecting to see with our strategies and activities. Next slide, please. And step three, developing evaluation questions. So finally, with our evaluation levels, process measures, and outcomes identified, we developed evaluation questions to help frame what we want to know about the work. You need to collect data to set up processes to be able to answer these questions that you or other stakeholders will have about your work. So it's important to think these through and make sure that they're feasible to answer. Again, not entirely exhaustive, but just a starting point and some examples of what we came up with. Next slide, please. And I'm going to hand it back to Kanikwa to walk us through step 4, which is where we'll start identifying our data sources.
Awesome. Thank you so much, Brittany, for that recap and intro. So there are several evaluation frameworks that recommend using, like Brittany kind of showed you, a grid or a table to illustrate how your evaluation questions align with the right data collection method or tool. And so we're hoping that this will help you to be able to document the process of gathering evidence to answer those evaluation questions. So here we've started by kind of giving you some specific columns to follow. So you'll start with, you could start with the evaluation question in mind, and then identify the data source or tool that you want to use for that question. However, we decided to reverse that approach in this example because there might be multiple evaluation questions that can be answered by a single tool. The key here is to use a tool like this grid or table to map out the ideal data source that you can use to answer those questions. And you can always, of course, adapt this to fit into your own organizational needs or context. So I'll just kind of go column by column and explain briefly what this means and what we're trying to do here. In the first column, you're going to specify the data source or tool that's going to help you answer your evaluation question. In the second column, you'll state the evaluation questions that the data source can inform. And remember, one data source can be used to answer many evaluation questions. The third column addresses the evaluation level that aligns with your question. The next column, or the indicator column, you're going to specify the indicators that demonstrate the extent to which your program has reached its objectives. Hence, this is why it's important to create those SMART goals or objectives, because they help guide this piece. And the information in this column is going to provide the evidence that you need to answer that evaluation question. In the next column, the measure type is where you would categorize the type of measure that's being observed by your evaluation questions and that's being measured by the data tool. In the next column, you describe your method of using or accessing your data to answer the evaluation question. And in the frequency column, this is just saying, how often am I going to access, use, or collect that data to answer that evaluation question? And finally, in the last column, here's where you're going to document, does a tool already exist? And if not, does it need to be developed? And it's important here to be able to specify that, because in this column, it's not necessarily where you're collecting the data. You're just documenting your process for, how you're going to either identify what data you need to answer that question. And then from here, this is a good tool to tell you, okay, if there are gaps between what data currently exists or what data I need, then I have a documented process for that. And I can make, a strategy to try and close that gap. So now I would like for us to walk through a few examples, or maybe one example, considering time, of how this grid can be used. And we're actually going to use app analytics as an example data source or tool that we're going to use to walk through this. So I'm actually going to ask Zoe to go to the next slide. And we're going to be using Slido to complete this activity as a group. So I really love your input and being able to do this piece just to kind of walk us through it. And so if you could either use your mobile phones to follow the QR code, or you can go to slido.com and enter the code on the screen to join. And we're going to leave the slide up for about a minute so that everybody can get to the poll. And then I'm going to share my screen so that you can kind of see, what those questions are, and we can see what those responses look like as people will start responding. So we'll give maybe like another 30 seconds. And then once that kind of comes, Zoe, I will take over the control and start sharing my screen so we can see what those questions look like. And I will say, just in case, if anybody has forgotten kind of what those columns were, we will go back to them here in a moment, but I'm just going to go ahead and pull up my screen so that you can see, and I'm going to ask everyone to respond to that first question that's in the poll. If we're using app analytics, so if we're, for instance, using a mobile app for a specific population, perhaps young Black MSM who are wanting to link to care, what are some evaluation questions that could be addressed by using analytics data from a mobile app? So I'm going to share my screen so that we can see maybe what everyone's kind of thinking in terms of like what some of those examples are. And actually, so if you can go back to the preceding slides, and hopefully everybody had a chance to see what some of those answers were. So we kind of helped you out there, but just using this as an example. So I'm just gonna stop sharing Zoe's screen. I'm gonna pull up my screen, and let's see. Okay. Oh, awesome. I see somebody, yeah, satisfaction with services. Definitely. Any other, yep, awesome. Thank you for putting the reminder in the chat, Brittany. Appreciate that. Okay. Frequency of encounters with the worker. Yes, absolutely. Now, I think it's important here to put your response in the form of a question. So we're not, rest in peace, Alex Trebek. But if you watch Jeopardy, I like the opportunity to frame your response as a question, because I think it gets us to get into that mindset of answering a question. So extra points to whoever puts their responses in the form of a question. Oh, awesome. How frequently are users logging in? Yes. And to the people who already responded, feel free to re-enter your input with the question mark behind it. I will give you points for that as well if you want to. Awesome. Hey, a lot of good responses. I like looking at the frequency of interactions or for logins, because that right there is valuable for you to know whether or not you're putting your maybe your money, your efforts, your staff time to good use, for sure. Absolutely. If the app is being used for, linkages, how many linkages are being made? Now that might come with some additional input. So for instance, you might do some deeper diving into perhaps providers to see if people who are saying they're using the app use the app and got linked to services as a result of using the app. But definitely those are some great questions that tool can help address. And I will say we're going to switch after these two. I see a couple of people responding. I'm going to give you a chance to put your responses in. But after those responses come in, I'm actually going to have Zoe maybe go to the next poll question that we have to see if we can get some more answers to that. So I think I may have to, let's see. Yep. Okay. So now we're going to find out from you what evaluation levels could be addressed by that tool. So this, I don't want to say there are no wrong answers, but I'd be curious to know, based off of using the app analytics from the mobile app, what evaluation levels are addressed by the tool. What do you think? Now, this doesn't have to be in the form of a question, but feel free to throw an exclamation point in there if you want to. That's totally okay with me. Yes. Yep. Priority population. I think that's awesome. I don't know who Anonymous is. All of you are anonymous, but I will say extra points to whoever answered priority population for sure. And just for time's sake, I'm just going to go ahead into the next question. And feel free, of course, as we continue to go through the slides, If you want to add your responses to the chat, that is totally okay. But the last question that I want to ask from you all is, what are some examples of measures or indicators that can be generated by the app analytics data? So how will you know? And I know some people kind of hinted at this in one of the previous questions, so feel free to repeat some of those here, but I think there's also some important indicators or measures to determine whether or not people are being linked to care. Yep, absolutely. Give some more. Yeah, awesome. Yeah, geolocation data. Yes, absolutely. Okay. Ooh, okay, let's see. Yes. Okay. Yeah, and I think looking at the number of users of an app and maybe comparing that against maybe, for instance, prevalence data will also be a good way to see, you know, because if you have a decent number of users, but that you have maybe some discrepancies between like maybe what your denominator is and within a certain location, you might not necessarily want to invest in using an app that has a low number of users compared to how many people you would anticipate using looking at that prevalence data. But yeah, absolutely. And thank you, everyone. I'm going to close a poll now just for the interest of time. But oh, duration of the app per usage or session overall. Absolutely. Thank you. That was very, very creative responses. And I will have Zoe go back to sharing the slides. Awesome. And so then what I'm going to do is actually, let's see, if you could go to the next slide, Zoe. And I'm going to hand it over to Brittany just to kind of go, oh, I'm sorry, back one, Zoe, to the grid. Yep. And I'm just going to hand it over to Brittany just to summarize this slide and kind of like take away some key points from that little exercise.
Thanks so much for that, Kaniqua. Yeah, I'm not going to go over this whole table, so no worries there, but we did want to share sort of what a completed table could look like. Again, there really is, like Kaniqua was saying, there's really no right or wrong answer here. I think it depends on the stakeholders, the evaluation questions you want to know, your team, your funders, your the people with lived experience. What are the questions they want to know about your work? So, you know, this is not an exact science here. But again, we just kind of wanted to provide an example of what a completed table could look like. So in the all the way on the left-hand side, we've identified some potential data sources. So we have the app analytics, we have a user feedback survey, we have a community-based organization and provider feedback survey, we have an EHE activity log, and HIV surveillance. Again, depending what you have access to, what you have capacity for, and what your organization, how your organization is set up. You know, these data sources may look different, but these are, again, just some examples of what could potentially be used. So we've identified those potential data sources, and we have also identified which evaluation questions that they will help answer, which levels of evaluation they're addressing, some examples of measures or indicators that are generated by that data source that will provide us evidence to answer our evaluation questions, the types of measures that these are, how we plan to use the tool and when, and finally, if it exists already or needs to be created. So breaking down your data collection into a table like this really allows you to help organize where data is coming from and how you can use it to answer your evaluation questions. And as Kaniqua will sort of start talking about in the next couple slides, is we want to be intentional with the data that we're collecting. We don't want to be collecting, I think a lot of us have experience with just having access to so much data that we almost don't know what to do with it. So we want to make sure that the data we're collecting has intention behind it. And this, having a data source table like this really helps you organize exactly how that is working in your organization. Next slide, please. And back to you, Kaniqua.
Awesome. Thank you so much, Brittany. So I'm just going to ask Zoe to click to the next slide, and I'll talk a little bit about how we really drive that process of gathering data or evidence, and talk about some data collection approaches. Now, at this point, if you're kind of going through this process, you've identified your process and outcome measures, brainstormed your evaluation questions, and using this previous exercise in that table or grid, you've started to identify data sources that can help inform your evaluation. Now we'll talk about how to access or collect the data from the sources that you've identified. Now, the question of whether to create a new data collection tool or to use existing ones should be approached with careful consideration and input from your stakeholders. So I'll emphasize that again, that's why kind of having that stakeholder engagement matters, because they can help you really make some critical decisions at this point. So you want to consider whether or not, for instance, you need to carry out primary data collection. So that's data that you're going to collect yourself, or whether you're going to use existing or secondary data sources. So data that may have been collected by somebody else or at a previous point in time. So for existing data sources, there are a few things to keep in mind. So some questions you might ask yourself are, is the data that's available sufficient to answer questions about your priority population? Do you have the staff, resources, and time to dedicate to collecting new data? Do some scenarios, so there might be some scenarios where you might consider using existing data sources. These might include clinical data to inform you whether a client has been linked to services or picked up medication, or administrative data that might tell you the extent that services were utilized. Now, your data from existing sources, these are easier to use because in your experience, you may know that they're already there. They've been used in other settings. They've been tested for reliability. So you can be sure that there's going to be some consistency in the populations you can use that data with, or in how you can apply and interpret that data. However, there might be circumstances where this isn't feasible or ideal, since it does limit your comparisons to more broader perspectives. So if you do want to make more specific comparisons or in specific interpretations, then you might consider collecting data from news sources or collecting your own primary data. Now, whether the data is available to you as current, or whether there are data quality issues or gaps in existing data, this is when we kind of talk about, how can I make sure that the data I need that can really effectively answer my questions is available? And the best way to do that is really to just collect the data yourself. So for example, you might be working with immigrant populations, and you may find that existing data sources have gaps, and you can only fill those gaps by collecting the data yourself. When you're thinking about new data sources, you'll also want to consider how you're going to use that data to inform and identify certain disparities that may be observed during implementation, or if you want to ensure equity in disseminating resources. A scenario where you might consider primary data collection would be conducting surveys to learn how clients are using services, or what barriers exist to client service utilization. So surveys, for instance, can be online, web-based, paper surveys. You can create surveys that you give to your clients to complete themselves, or you can develop surveys that you want to be administered by your staff. And really the key consideration here is, what makes the most sense for you. Do you have the staff time and resources to dedicate to collecting data from surveys from staff directly? Or does it make more sense to maybe collect the data and send that survey out to your clients, but understand that their interpretation could be different than how you may interpret delivering a survey. So those are just some things to think about. Another example of collecting primary data could be social media campaigns. So you could look at discussions or comments, at your own risk, because comments tend to get a little wild on social media, but in some circumstances, they do provide some very valuable information. So you can maybe collect information about, sentiment or public opinion, or identify trends. For example, you could look at and monitor trends for a certain campaign or a website, or use a survey or a focus group to get context on maybe what facilitates or even prevents people from using services or using that resource. And I just want you to keep in mind that these insights, especially because I'm talking a lot about really in some ways qualitative data, they give a wealth of knowledge. But on the one hand, you might find, for instance, if it's a website or even an app, like we were talking about earlier, you might find that people really aren't using it, or they're not interacting with it because they prefer to get their services or information in some other format. They might just prefer to get information from real people versus using an app. And you could also break that down by age and who you're marketing it to. I think we all have come to understand that more younger age groups are going to be more likely to use those apps versus older age groups. So maybe diversifying and tailoring those interventions to that population, which a lot of you are already doing, but just want to, kind of reemphasize that here. And I will also talk a little bit about, just integrating data sources. So as you can see here, one thing that you may also want to consider is integrating data from different sources to really make a holistic interpretation of what the evaluation data is telling you. And so you can formally integrate data. So that's, bringing in data from diverse data sets into one system or central database. And that just means that you don't have to navigate separate systems. Or more informally, integrating data could be, using qualitative data to provide additional context beyond what you find in that quantitative data. And so those are just some considerations that you want to think about. But as you talk about whether it's, using existing data, collecting new data, or even integrating data from different sources, keep in mind that there could be some legal and regulatory requirements for data that you have to navigate before you can obtain that data. So as you think about what that looks like, just consider whether or not you need or have in place like a DUA, like a data use agreement, a data sharing agreement, or a memorandum of understanding that's going to allow you to access data from other agencies. And one other consideration is, does the data that you need access to require informed consent from clients? We do recognize that there are some jurisdictions where if you want to be able to access and utilize that data, you do need informed consent from clients. It may seem like a barrier, but there are some ways to navigate that requirement to be able to access the data that you need to make those informed decisions. Next slide, please. All right, and you can skip right on ahead to the next one, Zoe. Thank you. So this won't be an in-depth presentation on conducting data analysis, but instead this is just an overview of some approaches that you might want to take to analyze your evaluation data. Now, as you approach your data analysis, you'll want to include considerations of improvements from a program perspective versus the perspective of the community or priority population. Different stakeholders might actually have different opinions on what constitutes success or improvement. So just keep that in mind. And I emphasize again here, that's why it's important to include your stakeholders and people with lived experience as you're going through this process. And Brittany said it before, but I'm going to reiterate here. We do not want to collect data for the sake of collecting data. You want to avoid the drip. And I will have Zoe just click ahead. And that is where your organization is data rich, but information poor. So you want to make sure you're using an evaluation grid or a table like the one we shared previously, because that's going to help you avoid the drip. And so basically you're not collecting data just for the sake of collecting it. Now, there are some ways that you might approach analyzing your evaluation data. And so the first of which is summarizing your data. You can click one, Zoe. So this is, for example, you might have a program that's utilizing case managers for people that are justice involved or in jails. So you could maybe assess the number or percentage of justice involved clients who are retained in care after release. And so you might see, for instance, 90% of those clients who got case management throughout their jail stay were retained in care upon release. You could also just describe the data based on certain demographic variables of interest. So that's race, ethnicity, age, gender, geographic location, whatever might be of interest to you. You could also make comparisons and knowledge between what happened before the intervention and what you found to happen as a result of your intervention. So for instance, I know a lot of you have done provider detailing. So you might have providers who, whether it's certain screenings, whether it's ED visits, they might not feel compelled to incorporate certain screenings into their workflows, but you could observe a difference after you've done those detailing on how many of those providers opt into doing those types of services. And then finally, you could explore trends over time or differences between groups, which is really another important way to assess the impact of your programs. So for instance, if we're looking at PrEP initiation within a certain time frame, how did that change? And how much can we attribute that to our intervention or our program? Next slide. Thank you. And so finally, before we adjourn, and I do admit I forgot to make the announcement earlier, this is only 1 hour today. So we just want to, if Zoe could open up the Zoom poll. Now, we did mention in part 1 that we would use part 1 and 2 to really inform the content for part 3. So if you could just take a moment and respond to the Zoom poll and let us know what can we do to make part 3 valuable to you. Do you have specific troubleshooting questions that we can help answer? Or would you prefer like specific topics where we can hold maybe an office hours sort of format and really design content around a specific topic? Or if neither of those options is ideal, what are some other approaches we could use, or what else will be valuable to you? And if something else will be valuable, please let us know in the chat. And it looks like office hours seems to be the most popular approach. So yeah, we can definitely do that. And if you could also, if you feel compelled to just share in the chat specific topics that will make office hours relevant to you for part 3, we absolutely will make sure that we include that to make sure that this is valuable to you. I will also make one more announcement, 2 more announcements actually. So Brittany mentioned in part 1 that we're working on an evaluation planning worksheet for you. That is being finalized, and as soon as it's available, we will make sure that you have that to use for your EHE program planning. And then finally, we ask that you complete an evaluation survey. We would be remiss if we did not practice what we preach. So we also like to use evaluations as well to improve, the content that we develop for you. So if you could take maybe a minute or 2 and complete the evaluation link, we would definitely appreciate it. And I think that wraps us up for today. So if you could maybe complete it, it's maybe like 2 minutes. And then if you have specific questions, I'll just ask Zoe to go to the next slide. If you do have any questions about today, we have maybe like 2 minutes left. Feel free to drop those questions in the chat. Alternatively, you can contact Brittany or I with those specific questions. We're more than happy to respond. But yeah, today's recording is going to be available as well as the slides. We hope that you found today's content valuable. And yeah, if Zoe or Brittany, if you have anything else to add, if not, I think we can adjourn.
Nothing from me, Kaniqua.
Awesome. Well, thank you everybody for taking the time out to join us today. And we will be seeing you in a couple of weeks for part 3.